Hi everybody, my name is Ruth Holliday. I'm Professor of Gender and Culture at the University of Leeds, and I'm here today to talk to you about our research on cosmetic surgery tourism, understanding the global cosmetic surgery tourism market. This paper is really based on our book, Beautyscapes, which was published by Manchester University Press earlier this year in paperback, and was written with my co-authors Meredith Jones and David Bell. The research on which it's based included 3 sending countries, the UK, Australia and China, and 7 destination countries: South Korea, Thailand, Malaysia, Poland, Spain, Tunisia, Belgium, and the Czech Republic. We interviewed 103 patients, 36 surgeons, 29 agents or medical travel facilitators, and 45 other workers in the industry, including drivers and nurses and hoteliers and so on. And we also traveled with and stayed alongside patients during their cosmetic surgery journeys. So this presentation basically explores the desire for surgery, paying particular attention to different cohorts and different kinds of surgeries, how patient consumers choose their destination and surgeon, and which information and resources they draw on to make those choices. And it also explores what patient consumers consider to be a good result and the implications of this for future medical tourists and the industry. So to tackle the first of these then, why cosmetic surgery? What we found was that official statistics very often underestimated the number of male patients. And because of this, they tended to construct cosmetic surgery as women's desire to be like perfect media representations of celebrities. However, in our study, for women and for men, changes to their own bodies were often a more important driver for cosmetic surgery than any external images. And we divided our patients into 4 groups, which I'll tell you about in more detail now. So first of all was correction, and this was surgeries such as ear pinning, so pinning back ears that stick out, birthmark removal, labiaplasty for labia that were considered too big, and so on. The second category was repair, and this was often a bit later in life, talking about repairs to injuries. So for instance, cauliflower ears sustained during rugby matches, or broken noses being re-straightened after horse riding accidents, but also breast enlargement or body contouring after pregnancy or weight loss. Anti-aging, of course, was about facelift, neck lift, eye lift, these kinds of surgeries, or sometimes breast uplift. And then there were the category of fashion surgeries. And in this category, we included things like the Korean look, which involved 3 surgeries really: jawbone shaving, eye widening, and augmentation of the nose tip. And this was very common in East Asia, whereas in the West, in the Western countries that we looked at, boob jobs or the so-called designer vagina were popular surgeries. However, we can't really sort of talk about these 4 different categories as self-contained and discrete. So sometimes patients, for instance, talked about going abroad to get a designer vagina, but what they meant in practice was repair to a birthing injury. Or people talked about getting a boob job, and that was more about correcting asymmetry than just having a breast enlargement. And all of these different groups considered cosmetic surgery to be an investment in their body, which was designed to improve their body and their self. So the second thing that cosmetic surgery patients need to decide is where to go. What destination should they travel to? And again, cosmetic surgery patient consumers are often portrayed in the media as clueless, impulsive, irresponsible medical tourists. For example, who might be on holiday in Thailand and purchase 2-for-1 surgeries on special offer being sold at the airport. But there are a number of vested interests in these narratives. So for instance, surgeons' organizations back in sending countries tend to play up these stories in the media to try and discourage patients from traveling abroad. And this kind of image could not have been further from the truth for the people in our study. Most patients used some kind of word of mouth to choose a surgeon based on the positive experience of friends or friends of friends, especially for what we might call fashion surgeries. Others who didn't know people that had traveled already tend to lurk for years on internet forums, narrowing down potential surgeons by scanning for bad news. And any bad news about a particular surgeon or a particular clinic meant that they were discounted very quickly. So positive reviews were vital for attracting more patients. Most in our study tended to use medical travel facilitators. These were often former patients themselves, and patients joined agents, Facebook's, Weibo, WeChat groups, watching patients' experiences of travel and surgery in real time before deciding on undertaking surgery themselves. However, despite this long period of research, once patients decided that they wanted their surgery and who they wanted their surgery with, they wanted to get it very quickly to avoid the anxiety of a long wait. For Australian and UK patient consumers, destination country was selected largely on cost as well as quality, and destinations like Thailand, Malaysia, Poland, and Tunisia provided very upmarket facilities at significantly lower cost than surgeons back home. And this was largely due to exchange rates or clinical costs in different countries. Some Australian women travelled in groups for fashionable breast augmentations, calling themselves booby sisters, who travelled with a booby mother who would be a former patient turned agent. But most people in our study travelled alone. UK and Australian patients were largely working or lower middle class, and they funded their surgery through things like small inheritances or tax rebates and so on. However, Chinese patients were wealthier and they were often paid more for their surgery in South Korea than they would have paid in China, because surgery in South Korea was seen as better quality. In addition, parents often paid for children's surgery, especially as in things like graduation presents and so on, for eye surgery. This market was very sensitive to perceived quality and risk. And so the death in Korea of a Chinese medical tourist raised significant concerns amongst potential travellers. So this is something that needs to be very carefully organised so that bad news doesn't circulate amongst, or so that there is no bad news to circulate amongst potential clients. So related to that then, a good result is paramount. Unlike other forms of medical treatments where a patient may be cured or otherwise, cosmetic surgery tourism has similarities and differences to this. It has a number of dimensions that are really important. So travel must be smooth. Travelers must feel looked after. So for example, a driver in Poland who had worked for a long time in the UK became almost as important as the surgeon in terms of managing diaries, because his role in putting patients at ease was seen as so vital to the organisation. Accommodation and hospitals must be really clean, and they must also be well connected with loved ones back home. So patients often travel alone and they often feel very isolated. And so being able to be in constant communication with loved ones back home is absolutely vital to patients' well-being and recovery. Destinations must be safe and culturally intelligible. So some patients from the UK that travelled to Tunisia were very alarmed that it seemed a very unfamiliar Muslim country with significant rates of poverty that they weren't expecting, because they had thought that Tunisia was in the Mediterranean and would be a bit like Spain. There's also the clinical results. So patients don't want any complications or infections, of course, but there is also the aesthetic results. So the surgery must meet patient expectations, and therefore expectations must also be carefully managed. Surgeons and agents mustn't overpromise on the results that they can deliver. But overall, personal recommendation was much more important than surgical qualifications. And bedside manner was vital. So surgeons giving attention and care to their patients was seen as something that patients were unable to access back home, and another reason that they wanted to travel. So just to sort of finish off then, one of the things that we would argue, I guess, from the book is that cosmetic surgery is about social value and not about self-esteem. Regardless of what surgery people had, they did see it as an investment in their body, a bit like an education is an investment in your skills and your mind, and a way of advancing yourself in both the labour market, but perhaps also in the marriage market as well. Many patients also felt better from the moment that they took the decision to have surgery, and some felt better even if other people didn't notice their surgical results. So how can we explain this? Well, cosmetic surgery is still seen as a bit of an elite practice associated with high status celebrities and film stars, even when patients have to travel abroad to be able to afford it. And high status doctors give care and attention to patient consumers, and therefore kind of confirm their value as people who are worthy of surgery. Cosmetic surgery then adds value for bodies, partly by making them look better, but it also marks a body as worthy of investment, of somebody as being a valuable person. To conclude then, patient consumers of cosmetic surgery have different surgeries for different reasons. They're not just a homogeneous group. Patients say they choose the quality of their surgeon rather than their destination country. UK and Australian patients were on low incomes, and affordability in their home countries and their surgeons' perceived lack of care was a reason for traveling abroad. So these are very price-sensitive markets. On the other hand, Chinese patients had more money and chose Korea because of its high quality reputation and association with Korean celebrities. But this should not be confused with wanting to look Korean or wanting to look like a celebrity. And vitally then, patient satisfaction is key to the future market, since future markets are so dependent on word of mouth. Okay, thank you all for listening, and here's some thanks to other people that took part in this project and the Economic and Social Research Council who funded our research. Thank you.